Hi, my name is Stephanie Gregory. I'm the lead nurse practitioner for Northside Hospital's Blood and Marrow Transplant and Cellular Therapy program.
My name is Jake Bartlett. I'm a physician associate also at Northside Hospital Blood and Marrow Transplant and Cellular Therapy Unit.
Today, we want to talk to you about the benefit of moving CAR T into earlier lines of therapy and what that looks like in clinical practice. And I'm going to let Jake start off and we'll go from there.
Steph and I see this on a daily basis over at our unit, and typically seeing CAR T used in an earlier line of therapy, it's really about giving patients the opportunity or the best chance at a durable remission, especially while they're fit enough. Historically, we have seen CAR T used as a later line of therapy. With that being said, though, these patients are already heavily pretreated. These patients are already typically refractory, which is why they are now getting CAR T in later line. Patients are sicker, they're more frail in a sense, and you see T cell exhaustion. And clinically speaking, using CAR T in an earlier line of treatment, these patients may be less subject to cumulative toxicity. So these include infections, marrow suppression, frailty, or anything of the sort.
Yeah, exactly. And I think we've seen that even in those settings, clinical trials with CAR T were, just astronomically great outcomes, right? But then once you start moving it into earlier lines of therapy, your outcomes are better and better, right? And when we think about multiple myeloma specifically, those patients also are so used to being constantly on some kind of therapy, right? And the benefit of moving CAR T up earlier is one, they're in better shape, and two, they get lasting remissions where they're not having to come in on a regular basis to get treatment and see therapy after therapy after therapy, which I think is just huge for them. And then to your point, Jake, you mentioned T cell exhaustion. Like if we can collect these patients earlier in lines of therapy, then we don't risk all the therapies that they've had damaging those T cells. So that makes them even more effective for those patients.
Yeah, and then, piggybacking off of everything that Steph said, typically when we're looking at the realm of multiple myeloma and we're talking about CAR T, bridging therapy, refractory patients, we're really thinking an end goal for these patients, which is remission, but we tend to forget a lot of the time of their quality of life in between that. Starting CAR T much earlier in therapy, like Steph said, allows them the opportunity to be free of coming from every single day or even being inpatient in the hospital. And so on the medical side, we're always thinking remission, and treatment, but it's always important to think of the patient, their family, and the life they had outside of a hospital to begin with. And I think CAR T in an earlier line of therapy really offers them that opportunity to, one, reach a durable remission, but two, also spend time with their family, spend time with themselves, doing the things that they've enjoyed outside of treatment before.
Exactly. And I think that really highlights the importance now of earlier referrals to a transplant or cellular therapy program, right? Because I think it almost means that as soon as you have identified a higher risk myeloma or disease, that maybe that patient needs an immediate referral just so that that cellular therapy program can be tracking that patient as well, so that once or if they relapse from their initial therapy, they can move quickly through CAR T, T cell collection, and move forward with bridging and therapy from there.
Certainly, Steph. And I think earlier CAR T is all about timing therapy when the patient is at their strongest. With that being said, traditionally, we've seen CAR T used in later lines of therapy. However, at that point, we also see shorter times of remission. So I think getting that referral in early, especially to a CAR T center, is important. Identifying that patient, getting them over to us so that when that time comes and we're able to treat that patient, we're able to treat them when they're strongest and when they have the opportunity to reach that durable, long remission.